Dear students, welcome back. In this session, we are going to discuss about iontophoresis, or it is also called as ionization. So, if you see the definition of this iontophoresis, it is a transdermal application of mild direct current to drive positively charged or a negatively charged ion of a drug solution into the patient's skin and the underlying tissues. This is called as ionization. So, simply we can say this iontophoresis is also termed as ion transfer, is the introduction of substances into the body for therapeutic purposes by means of a low voltage direct current. It is the single major use of direct current. Okay, so the use of iontophoresis, if you see the history, the use of iontophoresis was first reported in the early 1900s. Okay, and this one is proposed by a name called as Leduc. Okay, so historical uses of iontophoresis include use of tap water or an aluminum compound to treat hyperhidrosis of hands or feet. What do you mean by hyperhidrosis? That means excessive amount of sweat which are produced in hand or feet in normal conditions also. That means not during in any work or something, the person is doing some excessive exercises, so not in that conditions. Normally the person will produce more sweat in hands and feet, so that condition is called as hyperhidrosis. Okay, so iontophoresis has been used to accelerate wound healing using some of the ions like iodine, zinc or copper compounds. This one was done by Solan and Soltani in 1986. So in this method of transdermal drug delivery, each substance is separated into ionic compounds by the action of the current and deposited subcutaneously according to the imposed polarity on the electrodes. Here the primary route of ion transport across the skin is thought to be through the skin pores and the hair follicles. However, more recent studies suggest that iontophoresis may promote transdermal drug penetration primarily by increasing the permeability of the stratum corneum, the main barrier to transdermal drug uptake. So, therapeutic results produced depends upon the ion introduced, the pathology present and the desired effects. The practitioners should be aware of the multiple applications of iontophoresis with a wide variety of chemicals. So here the person in 1900 conducted an experiment called as Leduc's experiment, which explains the theory of medical ionization, and he proved that how these ions enter in the tissues. So now we are going to discuss about the theory of medical ionization. So the medical ionization is the introduction of therapeutic ions into the tissues by an action of constant direct current. So one pad is soaked in a solution containing ions to be introduced. So what kind of ions you want to introduce? So one of the pad is dipped into that ions containing solution and placed under the electrode bear the same charge as the ions. So here, if you want to give some chloride ions, for example, chloride ions is Cl minus, then you have to dip this negative ions to the negative pad only, that means cathode. For example, if you want to introduce lithium, Li plus lithium, which is an positive ion, so you want to introduce this positive ion into the body, then you have to dip the pad which is connected to the anode. Okay, so like that you have to place. So the same charges will be present on the same side, that means negative ions and cathode, positive ions anode. Okay, now the circuit is completed by the second pad and electrode, and when the current passes there is an interchange of ions between the pads and the tissues. Required ions are repelled into the tissues by the like charge of the active electrode. So for example, so you have already dipped into some positive ions, so lithium, so positive ions, so this is anode you have connected here. So what happens, this is the skin, so anode is having positive charge, isn't it? So what happens when you passes the direct current, okay, when you passes the direct current, other one is negative, okay, the cathode. So what happens, always like poles repel, isn't it? So here the anode is having positive and the pad is also dipped with lithium ions. What happens when current passes? There is a repulsion between these two ions taking place. Because of this repulsive force, this lithium ion enters into the skin. This is called as iontophoresis. Okay, got it? Yes. So the same thing, if it is having negative charge, you can put it on the cathode. So again like poles repel, and that for example chlorine we can take. So this chlorine ions will enter into the skin due to the repulsion which is caused by the passage of constant direct current. Okay, yes. So how can you prove that ions enter the tissue? So the lead conduct an experiment to prove this thing. So an experiment to prove the entry of ions into the tissue under the influence of current was performed by Leedux. Okay. He take two rabbits which were connected in series, these are the series connection, with each other to a source direct current. One pad on each rabbit, so one pad on each rabbit was soaked in a solution of salt of styrene, okay, styrene. So the other in a harmless solution. On the rabbit, the cathode was placed over the pad containing the styrene ions. Okay. On the other anode. So normally the styrene ions bear a positive charge, and when current. So here in this experiment again we will see. So what is happening? Two rabbits are connected in series. Okay, they have selected two pads for each rabbits, and they have dipped one of the pads in a solution of salt of strychnine. The other one is in harmless solution. Okay, so one pad is connected to the anode and another one is connected to the cathode for the two rabbits differently. So then what happens? Normally the strychnine ions are positively charged. That means the strychnine ions which is connected to the anode. Okay, so that one we can see on the A. So another strychnine ions are placed under the cathode. Now we will see what is going to happening when current is passed. When current is passed, the rabbit with the pad containing strychnine ions under the anode is died. Okay, so while the other rabbit was unaffected, because this proves that there is an entry of ions was due to the repelling effect of the anode and not to the absorption through the skin. So this is the experiment done by Leduc. That means, so the positive ions which is placed below this anode, once direct current is passed, there is an repelling effect is taking place. So then the strychnine ions enter into the rabbit A and which shows the effect. Okay, the rabbit A was died and rabbit B was unaffected. So in this experiment we have he proved that the ions only enter through the repulsive force of the ions, not as the absorption through the skin. Okay, this is called as theory of medical ionization. There is other evidence that the direct current causes the ions to enter the tissues. A visible reaction of the superficial tissues can be observed following certain ionization such as histamine and zinc were applied to wounds, but this reaction is not produced unless the electrode bears the same charge as the ions. Also, following ionization with some substances such as lithium, the ions may be detected in the urine although they are not normally present and could not have some from any other source. What is the value of this method? It is not possible to achieve any great depth of penetration of ions. So here we can't achieve greater depth of ions into the body. Okay, their speed of movement is slow and the current intensity and duration of the treatment are limited by the patient's tolerance. So there are many ions which are already present in the tissues and frequently these move more readily than those introduced. Also, as soon as the ions reach the blood vessels, they are carried away from the area in the bloodstream. So, as the ions do not penetrate beyond the superficial tissues, no direct effect of the ions can be obtained on the deep structures. So, however, effects are required on the skin, mucous membranes or surface of wounds. The method is of value. So it has the advantages that the treatment can be accurately localized and the dosage can be exactly controlled. This is one of the advantage. Some ions such as iodine may be introduced to enhance the effects of the constant DC, and when medical ionization is used, the effects of constant DC which are obtained in addition to those of ions which are introduced. So even we can change, there are different type of mechanisms of iontophoresis or there. That one we are going to discuss in the next session. Okay, a considerable variety of ions have been used for medical ionization in the past and new ones are introduced from time to time, but only in a few cases do their effects warrant extensive use. Okay, In the next session, we are going to discuss about the mechanisms of the iontophoresis, and also we are going to see the effects of various ions. Thank you.